Can a simple thread lift ruin your chances of getting a facelift later? You've probably heard people say, don't get thread lifts, they'll make facelift surgery impossible later. Others claim thread lifts are the perfect alternative to surgery. So what's the truth? Thread lifts have become popular because they're quick, minimally invasive, and require little downtime. For the right patient, they can provide a subtle lifting effect, but they're not a replacement for a facelift, and if you're considering surgery in the future, there are a few important things to know. A thread lift uses dissolvable, or sometimes permanent threads placed beneath the skin to gently lift sagging tissue and stimulate collagen production. The procedure is fast, usually performed under local anesthesia, and appeals to people looking for minimal downtime and a temporary non-surgical solution. However, unlike a facelift, thread lifts cannot remove excess skin or reposition deeper facial structures. So, can thread lifts affect a future facelift? The answer is yes, but not in the way many people think. Having a thread lift does not automatically prevent you from getting a facelift later. Experienced plastic surgeons routinely perform facelift surgery on patients who have previously had thread lifts. That said, prior thread lifts may create additional considerations during surgery. Depending on the type of threads used and how many treatments you've had, your surgeon may encounter scar tissue, fibrosis, residual thread material, or slight changes in the natural tissue planes. These factors can make surgery more technically challenging, but they rarely make a facelift impossible.
Before we continue, please visit answerplasticsurgery.com for more information.
Where things become more complicated is with multiple thread lift procedures. Patients who undergo thread lifts repeatedly over several years may develop more scar tissue beneath the skin, which can make tissue dissection more delicate and increase surgical complexity. This is why many surgeons recommend avoiding repeated thread lifts if you already know you're likely to have a facelift in the near future. It's also important to understand the limitations of thread lifts. They work best for younger patients with mild skin laxity and early signs of facial aging who want subtle improvement. For moderate to severe sagging, a facelift generally provides more comprehensive lifting, longer-lasting results, better correction of jowls and neck laxity, and a more predictable outcome. Think of a thread lift as a temporary refresh, not a substitute for surgical rejuvenation. Timing also matters. If you're already experiencing significant skin laxity, it's worth discussing your long-term goals with a qualified plastic surgeon. Some patients spend years and thousands of dollars on repeated non-surgical treatments that provide only modest improvement, when a facelift may have offered a more satisfying and longer-lasting result. That doesn't mean thread lifts are a bad option. It simply means the best treatment depends on your anatomy, degree of aging, and personal goals. Cosmetic procedures come and go in popularity, but the best decision isn't based on trends. It's based on choosing the treatment that will safely and effectively help you achieve your goals. An experienced surgeon will recommend the procedure that's right for your face, not the latest social media trend. The bottom line? Thread lifts can influence how a future facelift is planned, especially if you've had multiple procedures or permanent threads. However, in most cases, they do not prevent you from having a successful facelift. The key is choosing the right treatment at the right time with a qualified plastic surgeon who can create a personalized treatment plan.